So hello to everyone. We are pleased to start our series of webinars, which are devoted to healthcare quality and patient safety. And today we are going, to talk about very exciting subject, that is staff retention. Why is it so important? Because when we talk to medical facilities globally, this is one of the biggest concerns that usually they express is, okay, we will be doing this. We will be training staff. We will be educating them. We will be implementing the changes. But how to make sure that after the staff is trained, they do not leave and join our competitor? And this is a very, very reasonable question, we believe. So today we will have three wonderful speakers who will share their experience, who will share their practical tips and life hacks. And as always, we believe that you will find it useful. After the presentations, we will have, again, as usual, our questions and answer sessions. And questions you can ask through the chat function or through the question and answer function. And we already have some questions that arrived earlier by email and by in our Facebook group, and I will describe you our Facebook group and opportunities how to join it towards the end of the event today. So seems like we're going to have an interesting discussion, judging by the questions that already arrived. And now we move to the first speaker. Joseph Williamson. Many of you already met him, maybe even personally, because you know that Joseph is one of our assessors. Also, Joseph is a sonologist. So Joseph, over to you, please. You can share your presentation. Joseph, you are on mute.
Okay, there we go. My apologies. And now I'm going to share my screen. And can you see my screen?
Yes, we can see your screen, and maybe you can go to the presenter's mode to make it wider. Thanks a lot.
Thank you. Okay, thank you very much. Thank you and welcome to all that are on our presentation. We appreciate you taking the time out to tackle this very important subject of employee retention and employee engagement. And I think one of the reasons that I titled my presentation Employee Engagement is because that is an important part of the retention process. You know, one of my medical mentors always told me that employee relationship is no different from any other types of relationship. If you're not engaged in the relationship, there's no skin in the game. There's no reason for you to stay in the relationships. And so one of the things we noticed with employee engagement as I managed a busy hospital, I realized that if my employees were not engaged, it became very hard to hold on to those employees. And engagement was not just about getting the employee in their 5th or 6th year of work and then all of a sudden figuring out how to keep that employee there. Engagement actually started from before you hired that employee to figure out what the culture of your organization was. And we'll speak a little bit more about that. But before we get in there, I just want to give you some stats. There was a 2020 study in the year 2020 that was done by an HR research institute called Glint, G-L-I-N-T. And you can easily look this up on the internet. It's one of the consultants that we used in our hospital in the US to look at our employee engagement. In that study, they asked various HR professionals what they thought about staff engagement. And in the US in 2020 was very interesting that 47% of HR professionals, HR managers, thought that staff engagement was very good in their organization. Now, when that same study went into the organization, they found that there was, and I don't have it printed here, about 15% of the employees that actually agreed with the HR professionals, which means that there was a disparity between what HR thought and what was actually going on in the staff. More than 50% of the employees thought that their experience was tied up with senior leadership. In other words, when the employees were asked, well, why are you so disengaged? They said, well, it has to do with senior leadership. Now, we know that this is a little bit skewed because employee engagement actually has to do with both leadership and the employee. They have to come together at some point. They said that when you asked the employees, why they were disengaged and what was one of the main things they would like to do to be engaged, they said a sense of belonging at work. The inspiration to actually come to work was a huge part of their engagement. And we see that in our nursing staff a lot because nurses routinely are overworked. It's not even about salary. They're very overworked. And so they come to work very discouraged in the first place. And it's one of the reasons in the US and the UK that we have a high nursing turnover because they go to other things that are less stressful where they feel that they're getting recognition at work. And the ability to grow was at the top of the list why employees were disengaged. Now, that's very interesting to me because if you asked me, being an administrator, I would say it was the salary. I would say my employees were not getting paid enough. But when the poll actually looked at it, it was because the employees could not grow anymore. Now, we know that from nature, if you put anything in a situation where it can't grow, it dies. And so we found that with our technicians, with our doctors, with our nurses, with even our floor staff, that if they were put in a situation where there was no chance of advancement, they were coming in doing the same thing day in and day out, their manner of speaking was very dismal. So that was an interesting thing. Followed up by I looked, going back further, a Gallup study, and Gallup is another company that we used for evaluating our employee engagement. If you look at the money cost, the actual financial impact of having disengaged employee, we found that in disengaged employee, there was 37% higher they were absent 37% higher. And there was 18% lower productivity in disengaged employees. Now, if you're talking about in a situation where employees are just building wheels or employees are just sitting behind a desk pushing paper, that may be acceptable. But we're talking about employees that are responsible for patients' lives. So that 37% and that 18% translates into patient treatment. It translates into readmission. It translates into increased infections. It translates sometimes into death. So we have to pay very, very important note to that. And if you're looking at it from a business point of view, employee disengagement had a 15% lower profitability margin, which means your disengaged employees are actually minusing 15% of the profitability from your medical institution. So if you look at it, in a spreadsheet, we found that if your employees were making $10,000 per year, out of that $10,000, a disengaged employee would make $3,400 less than that $10,000. Now, my HR professionals are very, very interested in financials. So when you start speaking to them in this manner, now all of a sudden people start paying attention to why our employees disengaged. So let's go through a couple of things. Let's ask ourselves a couple of questions. What is employee engagement? What is employee engagement? Why do we need employees that are engaged? Because if you ask most doctors or most HR, they said, look, we just need people to come to work and do their job. That is no longer accurate. We cannot do that anymore, especially in high risk and high stress situations. Okay, third question is what affects employee engagement? It is a very psychological thing. Sometimes it's not something that you can collect data on, sometimes it is, but what affects employee engagements? And the fourth question I have for you is, what is organizational culture? Because we keep hearing this word over and over again. Organizational culture, we know affects employee engagement. How does it affect employee engagement? And then the final question that I would like you to ask yourself is, what is an employee engagement strategy and does your institution have one? That is a very important question. So engagement, we know, equals better healthcare. We know from research and we know from looking at patient care that the more engaged your employees and your staff are, the better healthcare they're going to give to your patients. Now, that goes beyond that, because if you actually think about it, if you have a disengaged staff, you're going to have disengaged patients. And if you have disengaged patients, it's a recipe for nightmare, because we've seen examples where disengaged patients don't follow medical advice because they're not connected with the people that are giving them care. Diabetic patients will not follow your advice when you go home because you've not connected with them. We did this whole thing on patient engagement, and we know that engagement of the staff is closely connected to engagement of the patient. Additional evidence in healthcare organizations shows that the high staff engagement have fewer acquired hospital infection. Why? Because the staff is paying attention. They actually care about washing their hands. They actually care about looking after sterile procedures. We know that engaged staff make significantly fewer mistakes. Why? Because if we're talking about tracking sentinel errors, we know that to track a sentinel error, you have to actually write it down, right? You have to keep a log of the errors that are made in your department. In my experience in going into hospitals with the IFC, I know that if your staff is not engaged, they're not going to be recording errors. And if you don't record the errors, you can't keep a track of what you can change. There's no KPI there if you're not recording it. We know that in addition, engaged staff leads to better patient outcome because the patients are treated better, they pay attention to instructions better, and you have a lower readmittance rate. Also with a lower mortality rate and a better patient experience. So basically, look, what is employee engagement and what is it based on? So scientifically, and when we look at employee engagement psychologists, they're actually organizational psychologists that go into places of employment, especially hospitals, and look at the staff as a whole to judge how they're treating patients and what's going on with that. These scientists say that the engagement is based on three behaviors. One, what is the employee saying about where they work? That's very important. Because when I go into my hospital, I start listening. I start listening to the nurses and the orderlies and the porters, how they talk about where they are. You can tell how engaged your staff is by listening to their conversation about your own department. Because what I found is when my staff was not engaged, that department was getting negative marks in their conversation. Oh, it's too crowded. We're too busy. You know, the work is too hard. Now, that work may not have been harder than last year, but this year they're less engaged and their tolerance is lower. Two, the second behavior is stay. The desire of the staff to be a member of the organization. Now, some staff, you'll find you ask them why they come to work, and it's very simple, to get a paycheck. If your majority of your staff is saying this, you have a problem because a paycheck will not re-engage those staffs. It may go a little bit to line their pockets or to satisfy them for a moment, but people do not necessarily stay at a job, okay, because you raise their pay $10 an hour. It's not going to happen. And the third behavior that you have to look at your staff is how they strive. Okay, we literally had technicians and nurses that would say to me when at the top of their engagement, look, we know our shift is over in 12 hours, but you're busy. So can we stay another 5 hours and complete the shift to help the staff that's coming on? This now I know is an engaged staff because they're not looking at themselves anymore. They're looking at the organization as a whole. In the US, of course, we're hit with snowstorms every now and then. And I remember this one young lady stands out in my head, and she had worked a 24-hour shift seeing patients. Snowstorm hits, and I'm walking around looking for volunteers to work the night and to also take their 4x4 vehicle and go pick up doctors. She was the first one with her hand up. I said, look, you've already worked 24. She goes, no, it's okay because this patient needs it. That is an engaged staff. But how do you get your staff there? That's the question. How do you get them to actually act like that? So you have to understand the levels of engagement. Every year, we went through our staff and looked at our staff based on these 7 levels. And we segregated our staff. And actually, as managers and administrators, we put our staff in these 7 levels. And I'll go through real quickly with you. You first engage an employee, and everybody's familiar with that. That's the employee that doesn't want to come to work. He talks badly about them, about the place of work, and he really does not want to be there. He's only there maybe because of the paycheck or because he needs, something to do during the day. Then you have the struggling employee. The employee that is going, yes, I'm disengaged, but I'll still be here. I'll still just keep my mouth shut and do what I'm supposed to do. That's a struggling employee. And every day he struggles with his managers, his supervisors. He really doesn't want to be there either. The inconsistent employee, okay, is one that waffles between whether he's engaged or whether he's great. That's a problem because someday he comes to work and he's great. He's doing things at top 10. Other days he comes to work and you'd think it was a different person. This is probably the most dangerous type of employee to have because you never know who he's going to be on a different day. One day he may be a surgery tech doing great surgery, and the next day he's forgotten to sterilize the pack. You see? So you don't know how to judge that kind of employee. These are the kind of employees that we would take and put in a special category and they would need special coaching. Then you have the average employee, which most of your employees are going to fall into that average lane where they come, they do their work, they go home, they're okay. There's nothing great about them, but they're just okay. And then almost last is you have the good employees, the employees that you can put in any department and they'll work, but they're not striving to do anything extra. And then finally, the great employee, like my employee that I gave you an example of that was willing to drive around and pick up other doctors to come to work. Now, just 3 of the ones I'm going to go over with you out of those 7. Your engaged employee, okay? The employee that is 100% turned on almost 100% of the time are the employees that are going to come to work and work with a passion and feel profound connection to that hospital or that company. They are the employees that are going to drive your innovation. They're the employees that are going to say, Joe, you know what? Instead of having this kind of equipment, I've noticed that we've had this kind of patient. Let me give you an example. In our emergency room, we noticed that our emergency room throughput when it came to ultrasound and radiology was dismally high. In other words, patient would wait a half an hour for an x-ray, which would increase the time they spent in the emergency room. So I was scratching my head trying to figure out how to get this throughput down because we all know if you work in a hospital that ER throughput pretty much dictates how your hospital runs because you're admitting people on different levels and you don't want anyone staying in the ER longer. So I had one employee contact me and they came into my office and she said to me, she said, look, I have an idea. Instead of having the patients go to the radiology department for their x-rays and their ultrasounds, why don't we create an x-ray and ultrasound room in the main ER? And that way the patients don't have to go anywhere and the doctors can get the results right away. And we put a radiologist and a sonologist in the ER. I said to myself, I wonder if that would work. We actually incorporated that and it reduced our ER throughput time by like 30% because patients did not have to go to radiology for those simple kind of tests because we realized that a lot of the patients that were getting radiology tests was either ultrasound or x-ray. Now, yes, we had our CT and MR patients, but those were minimal compared to those that were getting these portable tests. That is an engaged employee, an employee that actually is so connected that they want to offer different ways to help the company. Your non-engaged employee basically are checked out. They are completely checked out. They don't want to be at work. They come because they have to be, and they kind of sleepwalk their day through their work day. They put in time, but there's no energy. There's no passion. There's no want to be in your department. And I know that I'm talking to some people who are now scratching their heads thinking, wait a minute, I have a couple of non-engaged employees in my workplace. What do I do? Okay, these are employees that are going to bring your department down, and more than likely they're going to leave, and they're going to leave without you having the time to train somebody to take their place. Okay, now your actively disengaging is probably the worst type because these are not just disengaged, they're unhappy at work. They're going to really, really make everybody else around them unhappy. They're going to pick up the phone and yell at patients. They're going to misschedule patients and then yell at the patients when they've done that. They're the ones that are going to cause these readmittance problems that I'm telling you are going to happen. These are the patients that you're going to have to, I put it in a different way. These are the staff that I turn over to my competition. You need to go work for another hospital, because you will not work in my hospital because you have no place here, or maybe go find something else to do. And that's harsh, but at some point you have to actually realize that these actively disengaged employees are really hurting your business. So what are the 5 things that you can do as administrators to drive engagement? Number 1, senior management have to take an interest in your staff. Senior management no longer has the luxury of coming in, sitting behind a desk, signing paperwork and going home. You are going to have to take active engagement in your staff. One of my favorite things to do, and I'll get into this a little later, was to round with my staff. Just like I round with my patients in the morning, I would actually go into my staff quarters, into each division, and sit there and watch and talk and get opinions about what was going on, because you learn things that you won't normally learn on an evaluation sheet, and you learn how to fix problems before they start. Okay, so the first driver of engagement was that senior management take an interest in the employee or in the staff. The second driver, interesting enough, is your staff has to have challenging work. Your staff gets bored and they will become disengaged. Your staff feels that they don't have anything else to do but to push the same button every day, they will become disengaged. It is just human nature. Human nature says my brain has to keep active. It has to keep challenged. For that reason, we would make up things to keep our staff challenged, different projects that they could involve themselves in to keep them challenged. And that flows right into the third one, is decision-making authority. No one likes to feel like they're just a cog in a wheel. Okay, if you feel that you come in and you have no autonomy, you have nothing to do with the decisions that are being made around you, you're going to be disengaged. And let me give you an example. Off that throughput that I said with the ER, that example that I gave you of the throughput in the ER, you had one staff that I put in charge of that project. I actually said, you know what, you run this project. You consult with radiology, I will back you up. You consult with the imaging OEMs, and you purchase the equipment, I'll give you a budget for the ER. That staff is at the top of her game at this point because she's been given authority. She's been given decision-making authority. The fourth driver is customer focus. Especially in a hospital, if you find that your staff is not patient-focused, there is a big issue. Because this is what we're about in a medical institution. We're about the patient. It has to be patient-focused. And about 10 years ago in the US, it turned from money and financial focus to patient focus. This is why in the US, we went through this big thing of patient satisfaction. This is why in the US, a hospital does not get reimbursed until their patient satisfaction is above a certain score. And that behooves us now to look at our staff and say which of our staff is customer focused and which is not. And of course, the last one, as I mentioned before, is your staff has to believe that there are career advancement opportunities. Now, how do you do that in medicine? Because you can't turn a technician into a doctor and you can't turn a nurse into a doctor. So how do you do career advancement in an opportunity in a hospital? Well, we started our own technician training school. We said, okay, we're going to go ahead and get the zoning to start an X-ray technician training school. So we took orderlies and we turned them into X-ray technician. That was career advancement. We sent nurses, regular BSN nurses, to a 2-year master's program to do their nurse practitioner license, and then employed them, gave them a 2-year contract. If they choose to leave before that, that's fine, but we gave them a 2-year contract. So a regular nurse could become a nurse practitioner or a PA in our hospital. That kept our nurses in our system and then kept a constant turnover or only on the lower end. So that career advancement opportunity is huge. It's very important. Now, one of the things I want to wind down with is one of the things we think is that employee engagement starts with that 5-year period where we're trying to figure out why we're losing employees. No, it does not. It starts the minute you hire that employee. In fact, actually, it starts before you hire that employee. What's your hiring process like? In your hospital, if somebody applies, do you just go through their resume, their CV, and then based on their technical experience, hire them? I'll give you an example. In Johns Hopkins, about 10 years ago, they hired the head of neurology. That head of neurology basically had a CV that looked stellar. He was technically expertise. He had done all these papers, written these white papers on these innovative brain surgeries. But within 90 days, Johns Hopkins could tell that this person was not going to work out. He did not fit that hospital organizational culture. The replacement for him was somebody that had not written papers, had not gone to the top school, but had such emotional intelligence and was such a company and team player that he's now still at Johns Hopkins at as the head of neurology. So that interview process that you have in your hospital, I need you to ask yourself, what does it look like? What does your interview process look like? In our hospital, we do 2 interviews. We do a technical interview and a behavioral interview, 2 different days. So if you're a doctor applying to my hospital, we interview you as a doctor. Where have you been? What have you studied? What are your qualifications? All the general things we would ask a doctor or a nurse or a qualified technician. Then we score you. The second day you come back, we do a behavioral interview. There are a couple of behavioral questions we ask. If you have an emergency, how would you treat this? If a patient complains of X, Y, and Z and it has nothing to do with you, what would you do? Give me an example of a situation that you think you've been in that has been a difficult situation for you, but you made X type of decision. Now, based on that scoring, and we have a 5-panel interview, based on the score we give you is how we hire you. Because if that behavioral interview score dropped below your technical score, you are not going to get hired, because we realize that no matter how technical you are, your behavior is what drives you during the day. So you can be the top-notch brain surgeon, but if your behavior scores a 10% or less, we can't hire you. And I think in our hospital, that has been our way to keep our employee engagement high, is we don't hire for technical, because you know what? I can teach you the technical. I can send you to classes to learn the technical, but I cannot teach you behavioral. That is something that you're hardwired with. Right? So that and emotional intelligence, and we hear a lot about this in the corporate world today, right? Emotional intelligence. And believe it or not, in hospitals, it is just important, but it is also tied to our behavioral interview. Okay? I mentioned rounding. Okay? How many of you round with your employees? How many of you actually go as managers during the course of a day into your radiology department or into your nursing department and actually ask your employees questions? We know from the poll Gallup studies that rounding increases your communication, it increases your employee engagement, it increases staff retention, it increases clinical outcome and the quality of your medicine, and it also helps you create action plan. If you find that 10 employees are complaining about the same 10 things when you round, guess what? You've got to create an action plan to address that thing they're around. We had nurses complaining that something as simple as the air condition is too cold in the nursing department. Okay, well, the nurses don't set their own thermostat. That's set down in engineering. So to me, if I hear that 10 times and my nurses are unhappy, I need to figure out what's going on in engineering. And I need to follow that up. Now, that's a simple idea. A more complex idea is this surgeon is driving nursing away and I don't like this surgeon. If I hear that from 10 people, we have to address that surgeon. Okay, so if you don't address that, then your employees think we don't care. As managers, you don't care, and the disengagement sets in. And of course, improving the patient experience, which is at the top of our list to do. Okay, and I think that most of you who have this presentation, you really need to take a look at this wheel, and you really need to make this a basis of your employee rounding. We do it once a month. In our hospital, we round once a month on our employees, and then we take what we've learned and sit down as managers and go over what action plans we need to change to make our staff happier. A couple of the questions we ask our employees during the rounding is, do you know what's expected of you at work? Now, that seems like a very simple question, right? You'd be surprised how many employees waffle on that question. Okay, I'm an X-ray technician. I know I'm supposed to take X-rays of patients, but is it my job to, and then you fill in the blank. Is it my job to stay with the patient once the nurse isn't there? Is it my job to transport the patient back and forth from radiology, because we have porters for that? So your employees need to know exactly what's expected of them. That job description has got to be specific, and it changes. If it changes, you've got to change with it, okay? Do you have the materials and equipment to do your work right? Now, we talk about infection control, but we haven't given them hand washing stations. We expect them to wash their hands when they come out of every patient's room, but the sink is all the way down the hall. That creates a very frustrated employee, because I'm grading her on what she's supposed to do, but I'm not giving her the equipment to do it, okay? At work, do you have the opportunity to do your best every day, okay? Am I creating an environment where you feel like doing your best? In the last 7 days, or you can use a week or a month, have you received any kind of recognition or praise for your good work? Does your supervisor or someone at work seem to care about you as a person? Is there someone at your work who encourages your development? These seem like very basic questions, but these are some of our most popular rounding questions that we use in our rounding forms. And you'd be surprised, once we start getting a lot of no's on these, as managers, again, we sit down and say, okay, what's going on in this department? Why does the lab have the lowest engagement? Because their answers to these questions are all no. Okay, so lastly, I want to close up with this. What is organizational culture? I think this is hysterical because organizational culture is basically the sum of the organization's values, traditions, beliefs, interactions, behaviors, and attitude. Guess what? Guess how many organizations do not know what their culture is? I guarantee you won't guess. All the organizations that I've been in a hospital, I would say about 15% of those organizations know what their culture should be. Walt Disney is a great idea of an organization that knows their culture. They know what their culture is about. You go to Disney, they know exactly how you're supposed to feel, and they turn over backwards to make you feel that way. If I walk into a hospital, I said, what is your culture? They said, okay, how can we show your culture? I say, show me your mission statement. Some hospitals don't even have it. It's not posted. They don't know it. So my question to you is this: if you don't know your culture, how are you hiring for your culture? And if you don't know your culture, how do you expect your staff to work in your culture? It doesn't work. And so then you have a very discombobulated staff because they don't know what they're supposed to be doing. They don't know that your hospital, your maternity hospital's mission is to treat every pregnant patient, and they don't have that as a guide because you have not told them. Okay, so my first lesson to you listening that are organizational managers, that are HR, what is your mission statement? And are you living by your own mission statement? Because your mission statement is at the foundation of your organizational culture. It is the Bible to your organizational culture. And we know that culture drives behaviors and values. And from those behaviors and values, we find our staff has empathy, they communicate, but if they're obeying those values, you better have a reward system for that staff, whether it be promotion, whether it be increase in pay, whether it be giving them a cake at the end of the week. You have to come up with some kind of reward system because it's no different than having children. It's the same thing. These are your children for the day, but they are affecting the patients that come to you. Okay? So the best practices, in closing up, the best practices for staff engagement is very easy. It's actually so simplistic that we've not sit down and looked at it as managers. One, we need to focus. You need to focus on your patient experience. And I bet you expected me to say focus on your staff engagement. No, because if you're focusing on your patient experience, you know what your patients want, then you train your staff accordingly and you hire accordingly. If you're working in a geriatric hospital that you know it's all patients over 60 years of age, you don't hire someone that used to work on the labor delivery ward and loves babies. It doesn't work, okay? So you focus on what your patient engagement is and you hire accordingly. And you allow yourself to change perspective because that may change. So you give your staff training as they change. The second thing is create. Create a consistent message to your staff because consistency reduces anxiety in your staff and your patients. If you have a different message for your staff every day, they're going to get anxious because now they don't know what to expect from you. And then the patients don't know what to expect from them. And so you create a vortex of chaos. So make sure that your mission statement and whatever message you want to get across to your staff is expected and it is consistent. And the third is measure. How do you measure if your staff is consistent or not? You're going to have to create graphs and charts, and there are plenty of available models and tools to do this. Measure the progresses to fix the mistake, because if you don't measure it, you can't fix it. So if you don't know that your staff is dissatisfied with, a surgeon in a certain department, you can't fix that problem, but you won't know until you ask them. And you have to focus efforts on standardization of that staff also, okay? So building an engagement process, it's never going to end. If you are a manager for 10 years, you'll find that process is going to change every year. As your staff grows, as they change, it's going to always change. So don't expect it to be a concrete thing that you're going to put into place once and never revisit it. This is why I say rounding is a great thing to find out how you have to change that process. And also the engaged environments do not happen overnight. I think I was at my hospital as an administrator for 10 years, and it took me up till year 6 to realize that I had an engagement process that actually worked. So that's 6 years to build an engagement process. And I left the hospital after 4 years. So it won't happen overnight. It's something that you will need help with. It's something that you basically need to do day by day by day by day. And then the last thing I want to leave you with is the engagement process incorporates the entire employee life cycle, not just when they're working, not just when they're fired. From the time you put out an ad to attract the employee, to the time you recruit, to the time you do that whole onboarding session that you have to do with them, to the time you put into staff development, to the time you decide that this employee is going to stay with me for 5 years, till the time you let them go. Actually, that exit interview is one of your biggest engagement lessons ever. And you'd be surprised how many hospitals that I go to do not have a formal exit interview. If you don't know why the person left, how can you improve your process? It doesn't make any sense. So finally, the last thing I want to leave with you is make sure that you're paying attention to your engagement of your employees by everything that I've just said, but by also the entire life cycle of your employee. Thank you very much.
Thank you so much, Joseph. But this was just brilliant presentation as always, I believe. And lots of useful things you mentioned and lots of ideas to think about. And before we move on to the next speaker, I just wanted to sum up a few things, because I believe they are really important things, and we keep talking about it over and over when we are talking about staff engagement, when we are talking about creating proper culture of quality in medical facilities. So number one is leadership support, and it plays a huge role in whatever change you want to implement. If the leader is engaged, if the leader supports staff, if the leader is interested in the things that he or she is promoting, this is already 50% of success. And I wanted to give a little example from my own practice. I started my career in American Medical Center, which was founded by an American system by the team from the US in post-Soviet Russia. And the big change for us here was that any employee, even like nurse assistant, could reach out to the leader, to the CEO or CMO whenever they needed, with suggestions on change, with questions, etc. It was so innovative for the whole market of healthcare that nurses were literally queuing, wanted to be employed, not because of the salary, they said. We are coming because we can be heard and our opinion is respected. So now we are moving to the second important point that Joseph made, is opinions of staff should be respected, roles should be delegated, so there should be some decision-making power, as Joseph said. This will help you implement whatever change you want. Let it be staff engagement increase, let it be quality culture or whatever, it will definitely help. And third point that I was going to make, which you can also use as a sign. So what is the right culture for a healthcare facility? Culture where there is initiative, desire to help each other, desire to suggest some changes, as Joseph again mentioned, because some staff working in certain conditions might know better than the CMO sometimes how to improve his daily routine. So if you say, if somebody asks you for help and you are eager to help, it means you don't have burnout, you are not overloaded, you work as a team. And the sign of bad culture, to me personally, based on my experience again, is when you ask a person about something which is not related to his daily responsibilities, maybe like, what's our mission? Have you seen the policy from that department? Do you know if that department, who is on duty in that department today? They understand it's not their job responsibility and they are not interested in it. The answer is, I don't know. It's not my responsibility. It's a sign of a lack of engagement. It's a sign that something is wrong with the culture and it has to be treated as the patient is treated with the medication. It requires help. So I will pause here and we move to our next speaker, Dr. Zeeshan Ben Istiak. Dr. Zeeshan already was a speaker in one of our webinars, so probably you met him before. Dr. Zeeshan, the floor is yours.
Thank you very much. Thank you, Julia, and thank you, Joseph, for an outstanding presentation. So let me see if I can share my screen. So I hope you can see my screen.
Yes, we can see your screen.
Okay, thank you. So at the very outset, it is indeed a privilege and honor to speak today, and especially after an outstanding presentation by Joseph Williamson. So as it has already been said, that we need to understand the magnitude of the problem. The magnitude is huge. We need to understand that what we are seeing in any organization, that is just tip of the iceberg, whether they are engaged employees or they are disengaged employees. Whatever we see, that is just the tip of the iceberg. So we need to be very clear that whatever we do and whatever we see, we need to be very meticulous, and we need to understand that these are, and as we always say, that these are not the buildings that make an organization. This is not the bricks that make an organization. These are not the cement that make organizations. These are the people who make and who constitute the organizations and the institutions. So we need to find out that whether they are engaged or they are disengaged, whether they are with us or they are not with us, whether they want to stay or they want to go, and we must make sure that we don't let them go. So let's talk a little bit about what the data says. So if we look at the data, we will find out that we have an increased turnover in hospitals in the US. And this is not only in US. If we look around the world, we don't have that much data available, but yes, the nursing turnover is huge. It varies from 4.3% to 31%, with a national average of 15.1%. Then we lack sufficient nursing staff. We find out that even the turnover of direct care staff is huge. And we also find out that not only nurses, but even the physicians, they also report a lot that they are burning out. And if we look at the data, we will find out that 42% of physicians reported feeling burnt out last year. And this is data from Medscape 2021. And we also find out that 34 to 37% of nurses, they reported burnout. So it has been said by Joseph, so I won't really go in details of this one, but I just want to reiterate that there is a cost of nurse leaving an organization. There is a cost of any employee turnover that we find out, and this is not less, this is huge. And when we look at that, from where this cost comes from, so this comes from overtime payouts, this comes from the training costs that are there once an employee leaves and a new employee comes in. A lot of training needs to be done. And once this training is being carried out, once there is an onboard process is being carried out, so there is a lot of increased workload that is there on the staff. And what it costs? That's a business question. That's a patient care safety issue. So there are increased accident rates, there are increased adverse events, there are increased adverse reactions, there are increased sentinel events. The impact of continuity of care, there's a lot of impact on that. There are unplanned absences, and then of course, medical staff dissatisfaction. So let's talk about that. Where do we stand if we look at the international arena? So we will find out that up to 139,000 physician shortfalls in both primary and specialty care by 2033. We are anticipating that there would be 19% rise already Unemployed nurses, that is 2.71 million nurses in 2013, and what we are projected is the projected number of 3.24 million by 2022. And in the meantime, 525,800 additional staff would be required to replace the existing workforce. So there would be a deficit of 260,000 nurses by 2025. So let's talk about a little bit about physician burnout. So we are going through interesting times nowadays. We have COVID pandemic that is going on. And what we find out is that if we look at the data from Medscape 2021 Physician Burnout Report that was published in January 25th, 2021, we will find out that 49% of physicians were somewhat or very happy compared to 69% before pandemic. So what we are seeing is that there are less number of physicians who are happy after pandemic as compared to even if we compare it before the pandemic. And if we look at them, we will find out that 51% of female physicians versus 36% of male physicians reported burnout. We will also find out that previously in 2019, these were the urologists who felt burnt out a lot. Now these are the critical care physicians. And we do understand that is because of the increased workload and because of lots of factors that are there because of the pandemic. 79% of physicians said that their burnout began before the COVID-19 pandemic. So even they also say that once this was being looked at, that whether it is only COVID-19, so we find out that 79% who currently feel burnout, they say that they started feeling that burnout before the pandemic started. So the most common contributing factors to the burnout were 58% reported that there were too many bureaucratic tasks. So that has constituted the major chunk of physician dissatisfaction was because there's a small, simple thing that needs to be addressed. And in order to resolve that issue, there are too many people that they need to talk to. There are too many bureaucratic hurdles and channels that they need to exhaust before a single thing can be done. Then spending too many hours at work, that constitute 37%. And there's one more thing is lack of response from leaders and colleagues, that is 37%. So this is what Joseph has discussed in detail, the impact of leader rounds, the impact of leaders' engagement, the impact of leaders' involvement in the staff. So that has caused a lot of disengagement as far as the physicians were concerned. And the same holds true for the nurses as well. So if we look at the top 5 drivers of nurse dissatisfaction, we will find out that the topmost was the poor, unresponsive management. The second one was heavy workloads. The third one was low compensation. The fourth one was inadequate staffing. And the fifth one was lack of respect and appreciation from management. So physicians reported similar issues, but one major contributor was role of comparative performance measures. So let me talk a little bit about that. So what we find out that even if you look at the standards and ongoing professional practice evaluation, that's really on the rise. And what we are finding out is that the organizations, they identify areas of achievement and potential growth related to behaviors, potential growth, and clinical results compared with other medical staff members, and where possible, they also do external benchmarks. So sometimes this peer competition, this benchmarking, this internal benchmarking, sometimes the physicians have reported that rather than we being evaluated as one team, we being evaluated as individuals and then benchmark with other physicians, sometimes that is something that bothers us. And what we do understand is that we are in ever-changing healthcare landscape. The pace of change in technology is huge. The electronic health records are coming in, and some of the physicians, and in fact, most of the physicians, they are not used to it. The roles are changing. There is stress. There is pandemic. So the healthcare landscape, if we look around us, that is changing very, very fast. And that is also something that we need to look at, that once we say that we want our staff to be engaged, once we say that we want our staff to be involved, once we say that we want our staff to advocate for us, for the organization, and we don't want them to leave, then we need to understand that what are the challenges that are there, and we need to first identify them, and then we need to prioritize them, and then if possible we need to resolve them. But there are certain changes on which we do not have any control, and those changes are, that's the major one, is the ever-changing healthcare landscape, that we cannot do much about it. So there are multiple strategies, and there can be multiple strategies, and a lot of strategies have already been discussed, so I won't go in the details. But one thing that I want to focus on is the culture. And it is said that culture eats strategy for breakfast. I would repeat that culture eats strategy for breakfast. So we need to first identify the culture. We need to understand the culture. We need to identify the priority areas on which to work. We need to have a work plan for that. And then we need to work on it and then reevaluate the culture. And there are so many tools that can be used to evaluate the culture and then to work on it and how to benchmark on it. So compassionate and just culture aligned with organization's mission and vision. So it is important that we include culture. We include compassion as one of the major pillars of the organization's mission and organization's vision. We need to have a transparent ethical framework. We need to have a pivotal role of nurse managers in developing culture of retention. So we do understand, and sometimes in some parts of the world, we do understand that there is a hierarchical structure within healthcare organizations. So we need to overcome that. And it would be a process this would not be done overnight. So it would be a process, but we need to start that process. We need to initiate that process. And then we need to have key performance indicators and then have governance oversight of those indicators. And then we need to include culture as part of those indicators, and we need to find out that how that works. So there are certain strategies that do not impact morale or retention. And once we say that do not impact, again, these are all relative terms. So some people believe that increasing the pay of an individual, we are going to have a great morale and a great retention. So studies, they do suggest that yes, they are helpful, but they have a very less impact. So there are certain strategies that improve morale, but not retention. So we can have morale committees, we can have certain on-site childcare, recognition programs, education benefits. Yes, they improve the morale. They are all part of the strategies, but these are not the only things that we are going to retain them. So there are certain things that improve retention, but not morale. So again, Joseph has mentioned a lot about how to screen individuals, how to screen applicants to find out whether they are the best fit for the organization or not. We need to understand that screening of applicants with the right behavior, with the right EQ is important. And I would second what Joseph has said, that we can train them the technical skills, but we cannot change the behavioral aspect of their personalities because they're already been hardwired. So we need to understand that these are the individuals who create a culture in an organization. So it is important that we are very careful that which applicants and which people are we allowing them to enter in the organization, and then we need to monitor them. I won't go in the in the details of it, but there are different, employee engagement levels. So there's cognitive engagement, there's emotional engagement, there's physical engagement, and then people start advocating for the organization, and that is when they really feel that they are part and parcel of the organization. So again, I would want to say that few things that can be done, yes, they are important, but they are not the only one. They are active physician nursing engagement. People do it different ways, have committees, staffing, rounds, all those things. We need to have competitive compensation that's there. We need to have fewer hierarchical structures. What we have found out over the period of time is that hierarchical structures, if they are fewer, and if you can have less bureaucratic hurdles, sometimes that improves staff engagement and staff retention. We need to identify that to make sure that staff are comfortable by establishing one way is to have established staffing ratios and then not be fixated on that, but being flexible and then finding out and then reviewing them on periodic time basis, and then providing career ladders and educational programs. So Joseph also mentioned about that. I won't go in the details of them, but again, there are different ways, but we all need to grow. And I would second that this is not only growth in terms of that you give them, you give them an additional opportunity to gain another skill. It can be by providing them a career whereby they can improve their education. Sometimes they can learn something new. They can feel empowered. So all those things, those are the things that you can do that. And then implementing buddy programs, flexible scheduling. And it is also important to find out that yes, we are working in a healthcare environment. And we do understand that sometimes there would be issues. We need to have a fair and just culture. But we also need to find out that sometimes we all commit mistakes. And as part of those mistakes, if any mistake is being committed by any individual, it is not the individual or the patient that suffers. The individual who has been part and parcel of that central event or that adverse event or that adverse reaction, he is also a second victim. Because how we deal with our staff, because everyone is looking at it, and whenever there is a central event and whenever something bad happens, the entire organization look towards that one individual, that what is happening to them, because everyone feels that this can happen to me as well, maybe tomorrow, maybe today, maybe after a month or after a year or after 2 years time, we don't know. So we need to find out that what that person feels, and that is the time that if you deal with that person, you find out that how broken that person is. I'm not saying to that we need to get away with the erratic behavior. We need to get away with those people who are frequent absconders, those people who really do not follow the policies and procedures. But I'm saying that if we have a good culture, if we have a fair and just culture, we need to find out that how that person feels. So in the end, I would say that leadership, it is important. It has been mentioned, it has been said, it is the responsibility of the leadership to foster a just culture. It is the responsibility of the leadership to foster a just culture where innovation, freedom, structure, ethics, and morals are all present in right proportions. I would want to emphasize on the fact that it has to be present in right proportions. So that's all what I want to say. I thank you.
Thank you so much, Dr. Zeeshan. This was wonderful. Again, as always, because Dr. Zeeshan is presenting not for the first time, and we're pleased. It's a pleasure for us to have such a wonderful presenter. And again, I wanted just to sum up certain things, just to draw your attention to the importance of them once again. So number one, as Dr. Zeeshan said, different methods reach actually different targets. So if you are thinking about engagement or staff morale, you should consider this, that not always salary increase helps you reach all these targets. Unfortunately, there are other things which are as important as the pay increase for your staff, but at the same time, it's good because it's not only the money, and for the owners and for the top management, it also helps to reduce costs if you have other methods to increase staff engagement and to keep them interested in their jobs. And second important point is actually point related to hierarchy, because in our hospitals, we were always saying that hierarchy is actually the biggest obstacle on the way to building a good, efficient team, because it blocks most important things, such as openness, ability to speak up, ability to express initiative, etc. So if you want a good team, make sure there is less hierarchy in your facility. And now this third presenter, is Amr Osman from Logic Consulting. Amr, over to you, please.
Thank you very much. I'll share my screen. Hello, everyone. It's a great pleasure to be on this webinar, and I'd like to extend my gratitude to the IFC team for the very kind invitation. It's the two presentations that preceded mine makes it very difficult for me. Very powerful presentations, and I'd like to extend my gratitude to Joseph and Dr. Zeeshan for the insightful presentations that they gave. I would focus more on practical insights on how to make retention happen, with emphasis on succession planning as an enabler for retention. But before I go in depth into that, I'll take one step back and try to summarize the answer to a very tricky question. What motivates people? What motivates people to stay? What would make people stay? Because it's very controversial, and there are so many researches and statistics that says the number one factor is this, the number two factor is that. But I think the bottom line is to understand that we have to differentiate between motivators and hygienes. And to better understand the meaning of motivators and hygienes, we need to dig a bit deeper. Hygienes are basically essential work environment factors. So if we look at this brilliant model that was developed by Henry Hertzberg, it's a classic one, but I always believe a good theory is a best practice. So I thought of just adding it last minute. If we look at the 6 factors that he calls hygiene: peer relations, pay, supervision, work environment, job security, and policies. Those 6 elements would never make an employee highly satisfied. This is what we do to keep the employee neutral, to keep our staff fine, just willing to keep going, not highly satisfied and not highly engaged. But when we look to the motivators, the status that they feel, the type of work that you do, the promotion, the challenge, the achievement, the growth, the responsibility, the recognition, these are elements that would take satisfaction and would take motivation to a different level. So it's very, very important for us to stop and think about what we think we're doing for our people to make them happier and to make them more productive, and accordingly make them willing to stay. Because most of the time we would get answers that relates to hygienes. We have a nice environment, we have nice people, we pay them well. There are many programs that we do for job security. We have a very nice management culture. Well, this is not enough. This is not what makes people highly motivated. This would get them midway. And I'd like to quote Dr. Zeeshan when he said, "Culture eats strategy for breakfast." For me, coming from a business background, it's a scientific fact. You do all the planning you want, you do all the programs you want, but if you do not focus on culture, you would never manage to get the plans accomplished. So now I move to the second part, succession planning, which is the key topic of my presentation. Succession planning is a pathway to retention. And when we look at succession planning, we need to understand, I'm sorry, but I suddenly hear the French presentation, the French translation. I'm not sure if it's something wrong on my side. Right.
We hear something as well. We'll try to resolve this. Sorry about it.
Scheherazade, can you please mute?
All right. So basically, I would quote Joseph when he said that growth is the #1 enabler for people to be engaged. And when we look at growth from a broader perspective, we have to look at not just people growth, but we have to first ask ourselves, are we growing as an organization or not? Because if we're not growing, we will not be able to grow our people. And there are 3 interlinked pathways to organizational sustainability, which is now the fancier term for growth, because it does imply 3 different pathways. First, financial sustainability, making sure that we have the dollar to pay for our resources and to pay for our operations. But second is people sustainability. We need to make sure that we have the talents that we need to do what we need to do and to perform our job and to serve our patients. And third is process sustainability. We need to ensure that our operations will continue to improve and will continue to be better. Well, having said that, let's just put it in the back of our minds and get to the real questions on succession planning. And I have 3 questions that I plan to answer in my presentation. The first question is about the cost of succession planning. So what does it really cost to have successful succession planning programs in any organization? Because I'm going to tell you, it's not cost-free. It will cost. And the second question is structure. Is it an enabler or a restrainer? We're all proud of our organizational structures, and we invest a lot of time working on formalizing the structure and detailing the structure and improving the structure. So is it an enabler or is it the other way? And the third question has to do with retention itself. And it's a bit of a tricky question. Is the ultimate objective to retain people, or is it to retain know-how? Because definitely there is a limit to retaining people. People would eventually die. If you assume that someone starts his career in your organization and retires in your organization, this makes what? 50, 60 years at most, assuming that he retires at the age of 80 and starts work at the age of 20? Well, this is way shorter than the age of an organization, which needs to grow way beyond that. So for me to answer these 3 questions, I'll focus on providing you with practical insights on each one of these. So to start with the costs of succession planning, first of all, we need to understand that succession management is not just planning. It's strategy, system, and culture. Most of the time, when we think about succession planning, it's driven by the fact that Professor X is retiring and we need to figure out something and we need to find someone to fill in his shoe. Same applies on other key people. In this sense, succession planning is actually crisis management. This is not succession planning. When we talk about succession planning, we're talking about establishing a sustainable system that is part of our DNA as an organization. that continuously focuses on identifying potential successors and developing potential successors and building and enabling and nurturing culture, which I will come to in a while. So that's the first thing we need to understand. And that's the first cost element of succession planning. It will take a lot of effort and time, and it will take a lot of your energy and priority to make succession planning happen in its broader sense, and not just on the short term, like most of the organizations I have seen would actually do. The second thing, investing in identifying first-line high potentials. You cannot imagine the beauty and the energy that you can find when you get in touch with the first-liners. Most of the time, executives are so detached. They meet with department heads and with the senior staff most of the time that they leave little room for interacting with people and really knowing people. And when I say investing in identified high potentials, I mean investing, I mean money. I mean doing assessments and doing development programs, because in so many cases, we end up sending people to training programs that they don't need, and we end up sending them to conferences that they're not interested in, thinking that we're developing them. Well, not necessarily this is the case. But the second part of this point, the cost of succession planning, is actually a bit strange. When you do succession planning right, you risk losing some of your key people. And let me tell you, how does this happen? Most of the time, when you nominate successors, you nominate more than one. So you have a pool of successors for each position or for each person. And I would say minimum 2. So now those 2 potential successors would spend at least a year being joining shadowing programs and undergoing assessment and undergoing development programs till the big moment comes and we decide that X will be the successor and Y will not be the successor. Well, the bad news is the chances that you lose Y is very high. He's one of your best. He was a potential successor, but you got his expectations or her expectations very high, and now he's disappointed. He would leave. And this is always the overlooked cost of succession planning. It hits us after it happens that we lost some of our key people when succession planning happened. But this is life. And I think part of our maturity as executives and professionals is to understand and accept that we're going to lose good people, whether or not we like it. It will happen. This should not refrain us from investing and doing our best to not to make this happen, but being realistic, we have to accept that eventually it will happen. Moving on to the structure. Well, the first thing, we have to understand that without a career path that is vertical or horizontal, people would not see a reason to stay. People stay because they're interested in what's coming next. If I put it in very simple words, if they cannot see what's coming next, they will not stay. If the only way for me to grow is to get promoted and my manager is there, he's not that old and he's just joined, well, it seems that I'm stuck. And the only reason for me to grow is for this manager to leave or to die. That's it. So basically, the challenge here is the fact that the new reality is that either we grow fast or die slow. And this applies to any organization in the world. This applies within the organization to individuals. So the first challenge under structure is how to overcome the formality of the structure and the limitations of the structure. I would add that there is little room for innovation when it comes to hospital structure, because it's a very structured industry with structured practices and standards that leaves, I would not say no room, but leaves limited room for innovation when it comes to org structure. But the thing that you can do is to focus on job enrichment. So maybe I will not change my job title, but I'll change the job content. I would do things that would keep me interested and would make me want to stay. And we have to be careful when we do that in differentiating between the different job families. And mainly we do have 3 job families in a healthcare setup: the physicians, the nursing, and then the admin and non-medical staff. So when we do job enrichment, we have to go across the board and cover the 3 job families with careful planning. And here's an interesting insight. We have seen multinationals, maybe not healthcare organizations, but it's a trend that is happening in multinationals and in the big companies, where they create very slim structures and they focus on what I call informal structure. I have seen this happening in one of the hospitals that I worked with for 5 years as a strategy consultant in Egypt. And creating informal structure is mainly enriching and enriching jobs and making people interested in what they do by doing parallel things, having special programs, being part of committees, being part of specific task forces. Well, so I would keep doing what I'm doing, but yet there is something else that I'm doing on the side that I like it. And going back to the factors that Joseph actually mentioned, and he said, I would refer back to his slide, he mentioned 5 factors: senior management interaction with employees, challenging work, decision-making authority, customer focus or patient centricity, and finally, career advancing opportunities. Well, if we look at this pathway to job enrichment, we would find that it addresses at least 4 of these 5 factors. So now an individual contributor is working with top management, but on a specific task. The structure does not allow this, but this task force allows him to get exposed and to express himself and to grow. This is number 1. And now he or she is responsible for something. He's making decisions. He's engaged. He's going the extra mile. He's feeling appreciated and rewarded. Yet he's on the same box on the structure. He did not change. He did not grow. He did not get promoted. He's just having more interesting time in the hospital, doing the informal job that has been assigned to him. I think this is one of the most effective ways of engaging people away from the challenges of the org structure. Moving to the last point, when we say retention, are we talking about people retention or are we talking about know-how retention? I think the answer is very clear. We retain people because we want to retain their know-how. And for this to happen, we have to prioritize process assets, not just policies and processes, but lessons learned and guidelines and documentation in general. This is an endless journey that whenever it starts, it will never end, with focus on 2 things: automation and documentation. Automation makes you more capable of achieving process sustainability. Documentation makes it more possible for you to achieve process and people sustainability. So this would take a different mindset that does not look at retention in the sense of making people happy. Yes, but we retain people in order to sustain our organization. And we know for a fact that we cannot retain them forever. So the only way we can retain know-how is by focusing on documentation and focusing on automation and creating what they call a learning organization, where process and learning and knowledge assets are everywhere, and it's part of the DNA of our organization. This is extremely, extremely important. Then moving to the last point, culture. Again, culture eats strategy for breakfast. So without building a nurturing culture, which I summarize in 2 words, beliefs and rituals, having the right beliefs and doing the right rituals where people get to understand that this organization is people-centered. And believe me, this is the true definition of patient centricity. If you want to focus on the patient, you need to focus on your people and make them able to do what they are supposed to do so that they serve the patient. In business, we say you have to serve the internal customer in order for him or her to serve the external customer. And this will never happen without a nurturing culture that allows support, allows coaching, allows people to genuinely care about each other. If this does not happen, well, bad news. Nothing of succession planning and retention programs will actually work, because eventually people would act according to how they feel about the organization. So yes, succession planning is a key enabler to job retention, but it's not that simple. And there are a lot of considerations that we need to take in mind. I tried to cover the key questions and key challenges and focus on the practical insights that I hope would make a difference and would be insightful for you to go back and think about them and try to apply them in your organization. Thank you very much for your time, and I'm looking forward to your questions.
Thank you so much, Amr. This was very interesting, and actually we have so many questions coming and so few time left that I will not even be summing up because I think the presentation was very straightforward. I just wanted to make a small announcement and I'm gonna share my screen. It's about the new things that we started in IFC in order to help you improve, in order to guide you. Yes, Amr, can you please stop sharing? And I will share my screen. So 1 second. Can you see the slide now? I hope you can. So
Yes, we can.
in order to help, thanks a lot. So in order to help you get knowledge, sharing, discuss interesting experiences, cases, etc., we actually created a community of practice on Facebook. And on the screen below, you can see the link. This is an invitation. If you use this link, you can join this community. And again, we believe that you will find it useful because there we are going to post multiple tips and life hacks. Various interesting cases will be described there, like cases from daily practice of hospitals or some trends or interesting achievements. And also you will have a chance in the comments to discuss it with such hospitals as your hospital, but from somewhere around the world, because this is a global community. So we believe it's a unique chance really to share experience and to share knowledge. This is point number 1 I was going to make. And then I'm also excited to say that we developed in IFC online training modules. So these are modules on various quality related subjects. So the first 2 modules are devoted to isolation practices and hand hygiene. Basically, as you can guess, this was inspired by the COVID pandemic, but then we decided why should we stop and limit ourselves by only these subjects which are relevant these days. And we plan to extend the list of the online modules. We tried to make them very practical. They are free of charge. So we believe you and your staff will be able to go through these modules, fill in the gaps if you have any gaps in these areas, and believe you will find it useful, maybe refresh some materials, maybe assess yourself, and then implement certain practices, and this will make your practices safer and make your patients safer and your staff safer. So now we're moving, actually I will stop sharing, 1 second, and we will move to the question and answer session. So the first question, actually we have so many questions that I'm super excited today because I think the discussion is very vivid. So the first question is actually to all the panelists, and it is how to balance the organizational needs with staff individual needs if they do not coincide, how to compromise or where to compromise. Maybe some tips you can give to our guests, dear panelists.
Well, if I can start, Julia, I would have to say that this is a very, very dynamite loaded question, because the balance between staff and organization has got to be really, really thought out carefully. The first thing we have to figure out is what is compromisable and what is not, okay? In your head as a manager, you have to know what things you can compromise on and what things will cause you to say to that employee, you can no longer work here. And that has to be clear cut. That has to be given to the employee on the first day of work. In that employee handbook has got to be a list of things that these are non-compromisable rules of the employee, and everything else we can sit down and talk about. And I think what I've found is in most hospitals, this is not done. It's not in the employee handbook. It's not in the employee culture that, for instance, yes, you can be late 5 times, but if you're late 6 times, we won't really count it a big deal. So that is not there. So I think that the first thing, and I'll let my colleagues back this up, the first thing is we have to define what is compromised and what is not compromised. That's our first step.
If I may add to Joseph, I think we need to link them together. There is a term in organization behavior that is called instrumentality. Basically, people work to achieve personal gains. They want to grow, they want to get paid, they want to feel appreciated. Well, you need to make sure that they will never get that without doing you what you need. So basically, if I'm not as friendly as I want as a hospital with the patients, and yet I get my paycheck in full, well, there is an issue here. So I think the key enabler is linking the first level outcomes that the organization wants to the second level outcomes that the person wants through this instrumentality, and making sure this is the only way people would get what they want.
Mm-hmm.
Okay, thank you very much. And the next question actually relates to the previous one. Again, a matter of compromise. So today our speakers were talking about the external customer and the internal customer. So the question is whom to prioritize? Again, based on your experience.
You know, can I answer that question, Julia?
Yes, please, Dr. Zeeshan.
Okay, so I think what Amar has said and what Joseph has said, you know, it's extremely important. And I would again say that first of all, we need to find out and we need to understand that these are the people who make organizations. So that's the first and the foremost thing. The second thing is that we need to, what we have said, I think I've said it and Amar has said it, that culture eats strategy for breakfast. So these are the people who build and who make culture. So that's number 2. And once you make a culture, and somebody has given me and what is a culture? You know, the worst action that is acceptable in an organization defines the culture of an organization. So somebody gave that definition to me. So that is what Joseph has said, that we need to have few red lines And again, I would want to say that once we say that there are red lines, it doesn't mean that we have lots of them. But we need to have a clear-cut focus. We need to have that culture needs to be aligned with the mission, vision, and values of that organization. So, and apart from that, and being in a healthcare organization, we do understand that we do exist because of a mission that's there. That's the reason for our existence, is not to make money. Yes, making money, it's as good as the blood, that the function of the hand is to really hold things, but it is the blood. Without blood, this hand is not going to function. And that blood are the finances. But that's not the reason for existence. And our reason for existence, being in a healthcare profession, is to help our patients, to help them reduce their suffering, to provide safe and quality healthcare to our patients, to provide safe environment for our staff. So again, we need to align that and create that culture where everybody works together as a team in order to achieve this common goal.
Thanks a lot, Dr. Zeeshan, and it's great that you make this point specifically about the importance of mission and vision, because when we ask hospitals whether they have mission and vision, they are sometimes confused because they think it's not important. But basically, as Joseph earlier said, mission and vision are the guiding lights, and they explain everything to you. They explain to the team. They explain why these changes are being implemented, because the vision is to become the best in the region, for instance. And in this case, your employees will not be asking you questions, why should we do it? Because the other hospital is not doing this. Because you are going to be the best in the region. So mission and vision, do not underestimate them in your quality improvement work and in your staff engagement. So the next question is very practical one, and I think very important one. So say there is a hospital in a remote city in Kenya, and they are excited about what they heard today from all the speakers, but what should they start with? What advice can you give them on the journey of increasing staff engagement, and what tips can you give them? How to start considering its emerging model?
So, Julia, I would want to quote Joseph over here. Joseph said that it is a process, and you are not going to do it overnight. So it is a journey, and it is not a destination. So you need to start small, identify small baby steps, and then work on that. The second thing is, one thing that we always, we need to understand, that employee engagement, quality improvement, patient safety, this is being part of a journey. This is not a destination. So different people in different organizations can be at different levels during their lifetime. So it is okay to be at this level and then graduate to the next level and to the next level and to the next level. So whether you are in a remote village in Kenya or you are sitting in Manhattan, it is a journey. You must embark your journey towards the destination, and you will never reach that destination because there is always a next step waiting for you.
Thanks a lot, Dr. Zeeshan. This is a great comment. Joseph, Amr, anything from you on this based on your experience?
Yeah,
Yes.
I would say that the very, very first thing, since the question was very specific, if there is one thing you can go today and do today, is go talk to your people, listen to them, discuss the whereabouts of the work environment, what is making them happy, what's not making them happy. You will never be able to address 100% of it, but then going back to Dr. Zeeshan, choose something and work on it. This should be enough to get you started.
I totally agree with that. It's 110% agreement. And that is called rounding. This is why I'm so interested in rounding. A lot of hospitals, they put all this effort into rounding with their patients, but no one ever rounds with the employees to find out what are the employees thinking. And then the last thing I would say is, if you're going to start a process like employee engagement, put 100% into it. One of the worst things I ever hear is, well, Joseph, we don't want to like put all this money into training and then they're going to go ahead and leave. Well, my question is, if you have badly trained employees and they stay, how well does that make your hospital? So I'd rather take the chance in training them well and have them leave than not training them sufficiently and have them stay.
Thanks a lot, Joseph. Actually, we received several questions regarding measurements. Once we started to talk about measurements, do you have any formula or any index how to measure turnover and how to measure and assess staff engagement? Because several people asked us this question, maybe some resources that you can recommend. Yes, please.
Yeah, there's a lot of resources that can be used. And of course, we can, Julia, email people these links that they can use. But, you know, the Gallup polls, which is the poll that we use to do our employee engagement, has free charts and free questionnaires. And I think the questionnaires are very important because they put you on the right track of the right questions. And I went over a few of them that we use to ask our employees every 6 months. So I would say to those participants that are here, we can email you those questionnaires.
Thank you very much. Amr, anything from you on the formulas and methodology?
Well, the turnover formula is very simple, and I think it's very easy for any organization to measure it. But the challenging part is measuring engagement. If I add one little thing to what Joseph had just said, yes, survey is your way to do this. However, I'm sure that the first survey you will launch will never give you indicative results, and you would go back and realize that you missed a few questions. And there are a few questions that were not indicative, and you would, the thing that you need to do is to make surveys part of the routine. We have to, every time we improve the survey, we relaunch the survey, we listen and analyze and see how things are changing and listen to the pulse of the organization. Well, people are more happy with this and less happy with that, and get some early warning signs on what's going right and what's going wrong. And besides those two main measurement tracks, I think it would be just overwhelming to look at complicated matrices to measure this. I think those are two straightforward measures that any organization can apply.
And Julia, just to add on what Amar and Joseph has said, you know, I would again suggest start small. Start and you can be at different levels. If you are just starting and you are willing to embark on this journey, start small, even start from one question. And it has to be a process, has to be repeated, and it has to be a routine. It should and must not be a one-time activity.
Okay, that's wonderful. Now, very tricky question, very tricky, straightforward question, which relates to leadership and to payment, to the salary. So number one, it actually consists of several parts. So number one is, can a hospital that has low salaries comparing to the market retain staff? This is number one. And second part, if in the hospital there is strong hierarchy, and the staff, frontline staff, they understand that their payment is not as high as it could be, but there is no contact with the leadership, like they cannot raise that question. So how to change this situation? How to approach it? This is a tricky question, I know, but interesting to discuss.
It's a very, very tricky one. I'll try to start with a simple answer to the simple question. So can we, not paying high salaries, can we retain people? Well, a simple answer is yes, you can. It depends on how. Well, as I mentioned in my presentation, pay is not considered a motivator. It's a hygiene. It will never, this is not what makes people engaged. This is what would make people disengaged. And by the way, by definition, engagement and disengagement are not opposites. They're two different things. Satisfaction and dissatisfaction are not opposites. They're two different things. There are factors that will make you satisfied and factors that will make you dissatisfied. if the factors that will make you dissatisfied are properly addressed, this does not mean that you would be satisfied. It means that you will not be dissatisfied. So this is part one of my answer. Part two of my answer is job enrichment, as I was speaking, is one way of making people willing to stay, even if they're not paid. But the tricky part, if we talk about money, the number one reason people are not happy with pay is not the level of pay. It's the equity in pay. So if you have poor resources, make sure you do have proper grading structure and pay scales. Make sure that you're being very fair. Make sure that there is no freshly hired nurse that is paid more than a nurse that has been there for 3 years. This is what kills them. So if you just make sure that you're achieving equity and you're being fair, this is the maximum you can do in a resource limited setup in such a situation. So those are very two important factors: equity, job enrichment through additional factors besides the job description that a person does.
And if I can add,
Yeah,
if I can
please.
add to that, the equity is, I can't even begin to tell you how important that is. And from experience, I learned the hard way. I hired an employee, and because they came from a trauma center, okay, I paid them more. Now, within a year, that had circulated through the department, and I found my engagement scores dropping. I didn't know why. And then when I started doing the research, I figured out that they're doing the same job, but because they came from a trauma center, I paid them more, and I had to correct that. And it cost me to correct that because I couldn't lower their salary. I had to actually bump my people's salary up to that. So that cost me a trip to my manager's office and some really harsh lessons. So the equity is extremely important. So if you're working in a low research setting and people are getting paid $10 an hour, then make sure that your top pay is $10 an hour based on experience, based on time there, but you're not going to pay the next person that comes in $15 an hour. It just doesn't work that way. And that will kill your employee engagement.
So being the third one, answering the same question. So I'll just add on a few things. First and the foremost, fairness is the key, what Amar has said. But he has said, job enrichment. So I would add another word, job enrichment and empowerment. So sometimes that really helps. Empowerment helps the staff. And last but not the least, on a lighter note, my salary is less. This is a relative term. So you just need to make sure that you define, and once you are fair and you have a structure in place, so then, and it's very difficult to define that what is less salary and what is more salary. The important thing is that there has to be fairness. The system needs to be fair, and it varies a lot. It varies a lot how you look at that, what is a good salary, what is a reasonable compensation. But there are multiple studies that would suggest that it is not the salary, it is fairness, it is the culture of the organization, it is job enrichment, it is improving as a person, as an individual, as a professional, and then empowerment and the ability to deliver and the ability to provide care to the patients, and to be able to feel that we are contributing as an organization, and as part of that organization I have an important role that I am playing. So these are the factors. So it really, and again, saying that we are at a resource scarce country or an institution, again, that is a relative term. If you compare it one country with another country, and then within that country, one city with another city, and within that city, one organization with another organization. So, and one department, another department. So with the different types of skills that you have. So, it's all relative, but you just need to be very fair, have that capacity, have that feeling of empowerment and enrichment that helps.
Thanks a lot. And any specific procedure regarding the managers, the admin staff? We talked a lot about nurses and doctors, and what about the engagement of managers? Any specifics with that? Or same approach?
I think it's the same. You don't really, it's not about being doctors and nurses and managers and other healthcare staff. So we all are, these are human beings. You are dealing with a human being. So you are not dealing with robots. Healthcare is a human resource intensive industry. So you need to feel that you are dealing with humans, and your patients are humans. Your patient care providers, they are humans. So it really does not matter that whether they are physicians, they are nurses, they are housekeeping staff, or they're engineers, or they're managers. It's all the same. You just need to make sure that you create a culture that where everybody works together as a team in order to achieve this common goal towards safe care, providing safe care to the patients.
Thanks a lot. Yes, Joseph, please.
There is, in addition to what the good doctor just said, there is a animate, it's called PEP, people, environment, and process. And when you look at how a hospital or a patient care environment is run, they're judged on those three things. Now ask yourself, what kind of people are involved in those three things? It's doctors, it's nurses, it's administrators, it's the floor cleaner, it's the person that changes the light bulb. All those people are involved. So for me to treat a doctor's engagement different than I treat an administrator's engagement would not be fair. So in agreement to the doctor, you have to treat them all the same. When I do engagement in a department, I give the same questionnaire to the doctor as I did to the receptionist. It's the same thing.
Thanks a lot, Joseph. And before we conclude, because soon we will have to, another question, which is also a tricky question, but I think it reveals the reality that many of us are living in. I mean, many of medical institutions are living in. How to successfully implement the system of staff engagement if the leadership, the top management, and the board of the directors are actually conscious of reputation risks, any novelties, and its authoritative old style model of management, while the team understands the importance of the staff engagement program, but leadership is afraid of any change and any risks. How to bring them on board?
Julia, I would want to say that leadership is a stance. It's not a position. So that is a stance. And, and you always can have that stance, and you can make a change at any level. So, otherwise we can always say that if I'm a frontline staff, I can say that my floor manager is not doing what needs to be done. Tomorrow, if I'm a floor manager, I would say my CMO or my chief nursing officer or my chief operating officer is not doing what is supposed to be done. If I'm the chief medical officer, I would say my chief executive is not doing what is supposed to be done. And if I'm the chief executive, I would say my board is not doing what needs to be done. And if I'm on the board, I would say my government is not supporting what needs to be done. So again, it is a stance and it is not a title. So you can always have that stance and you can make a difference. So, and again, these are the people who make organizations. These are the people who build cultures. So it's always that you can take that initiative and you can take that first step, and other people usually they follow.
Thanks a lot, Dr. Zeeshan. Amr, you wanted to say something? Yes, please.
Yeah, actually, I wanted to continue on what Dr. Zeeshan has just said. Well, definitely, top management can make it or break it when it comes to organization-wide engagement. But I always tell people that you have to differentiate between the organization and your organization. Your organization is the team that you're part of, the pyramid that you sit on top of. So you can be a middle manager and engage your people, even if the total organization does not promote culture of engagement. And we have seen this numerous times. We have seen bright points in the middle of darkness, if I can put it this way. You can see a very authoritative and old school hospital, and then you find this head nurse that somehow manages to engage people and create a very, very positive culture. So yes, this is an enabling factor, but it's not a deal maker or breaker all the way. You can make a difference within your organization, your pyramid that you're part of.
Thank you so much, Amr. So we are running out of time. We've already exceeded the time that we claimed, as always, but I think it's nice to have such wonderful discussion. Yes, and the audience is still present, so it's a good sign. So sorry for taking more of your time, but I hope you understand why. I hope you found it useful. So a few organizational issues before we conclude. So we will share a short presentation of 3 slides with instructions how to find the access to the online training modules that we mentioned. Once again, I wanted to draw your attention to the fact that we now have issued 2 online training modules, but there will be more, that they are free of charge. So you're welcome to start using them. And also, you're welcome to send us the feedback, because that's what we are interested in. As usual, this webinar was recorded, so we will share the link with recording with all the presentations and all our speakers and questions and answers as usual. And the link for our Facebook group, we will also share as usual. So thank you very much for joining today. I think it was a very hot discussion, and I hope you learned lots of interesting things. I hope we inspired you to start changes in the area of staff engagement and retention. And we look forward to seeing you next time on our next webinar, and the date will be announced edition.